Welcome to another episode of Trial Site News. On today's show, we're going to be discussing the story surrounding the CDC and the FDA, who have identified a potential safety signal for ischemic strokes associated with the Pfizer vaccine. But don't worry, my friends, the CDC also said, after it launched its investigation into the safety concern, that it was very unlikely that Pfizer's Omicron boost carries a risk of stroke for seniors ages 65 and older. We're going to discuss what is happening here. And so from Trial Site News, I am Adrian, and our episode is starting right now. So, the Center for Disease Control and Prevention, or the CDC's Vaccine Safety Datalink, met the statistical criteria for a safety signal. The agency announced further investigation into a possible link between Pfizer's bivalent shot and ischemic strokes and those over 65 years of age. However, in the meantime, they have not changed their recommendations. Here is what the CDC said on the matter. They said no change in vaccination practice is recommended. The CDC continues to recommend that everyone ages 6 months of age and older stay up to date with COVID-19 vaccination. This includes individuals who are currently eligible to receive an updated bivalent vaccine. Staying up to date with vaccines is the most effective tool we have for reducing death, hospitalization, and severe disease from COVID-19, as has now been demonstrated in multiple studies conducted in the United States and other countries. Now, while the CDC puts out this statement, they also seem quite concerned about hammering home the mantra that transparency and vaccine safety are, quote, top priorities for the CDC and the FDA. Good to know. It's always a positive thing when transparency and vaccine safety are top priorities, right? Now, interesting here was the mainstream media's reporting on the matter. It's a mixed bag. Some news outlets, like CNBC, had very defensive headlines emblazoned on their website, focusing on the CDC saying that it is very unlikely that Pfizer booster carries stroke risk for seniors after launching review. While others, like Reuters, put out a more honest headline, focusing on the US FDA and CDC seeing an early signal of possible Pfizer bivalent COVID-19 shot linked to stroke. It will be interesting to see how the mainstream media going forward focuses on adverse side effects surrounding the vaccine. It'll be something worth keeping your eye on. In any case, the CDC reported that they must embark on formal epidemiological studies to confirm any signals that represent an actual concern with the mRNA-based product, or if it can be assessed to have no clinical relevance. And the agency also went out of its way to make it known that the totality of the data currently suggests that it is very unlikely that the signal in VSD represents a true clinical risk. Here's how they put it. We believe it is important to share this information with the public, as we have in the past, when one of our safety monitoring systems detects a signal. The CDC and FDA will continue to evaluate additional data from these and other vaccine safety systems. These data and additional analysis will be discussed at the upcoming January 26th meeting of the FDA's Vaccines and Related Biological Products Advisory Committee. Now let's turn to focus on the VSD signal. Following the availability and use of the updated bivalent COVID-19 vaccines, the CDC's Vaccine Safety Datalink, a near real-time surveillance system, met the statistical criteria to prompt additional investigation into whether there was a safety concern for ischemic stroke in people ages 65 and older who had received the Pfizer-BioNTech COVID-19 vaccine bivalent. The rapid response investigation of the signal in the VSD raised a question of whether people 65 and older who have received the Pfizer-BioNTech COVID-19 vaccine bivalent were more likely to have an ischemic stroke in the 21 days following vaccination compared with days 22 through 44 following vaccination. Now, interestingly, the agency also reported that the preliminary signal thus far has not been identified with the Moderna COVID-19 vaccine bivalent. And the CDC also suggests there may also be other confounding factors contributing to the signal identified in the VSD that merit further investigation. Furthermore, it is also important to note that to date, no other safety systems have shown a similar signal, and multiple subsequent analyses have not validated this signal. Here are some of the points that the CDC made in their update on this VSD signal. They said that a large study of updated bivalent vaccines from Pfizer, BioNTech, and Moderna using the Centers for Medicare and Medicaid Services database revealed no increased risk of ischemic stroke. They also say that a preliminary study using the Veterans Affairs database did not indicate an increased risk of ischemic stroke following an updated bivalent vaccine. The Vaccine Adverse Event Reporting System, otherwise known as VAERS, managed by the CDC and the FDA, has not seen an increase in reporting of ischemic strokes following the updated bivalent vaccine. Additionally, they say that Pfizer BioNTech's Global Safety Database has not indicated a signal for ischemic stroke with the updated bivalent vaccine. Now, worth noting here, the CDC is out the gate assuring everyone that the totality of the data currently suggests that it is very unlikely that the signal in VSD represents a true clinical risk. It would almost seem, then, that the agency is attempting to use this process to bolster up the cratering confidence of the American people in regard to both present and future vaccine doses. For example, as of now, only 16% of adults over the age of 18 years of age have received the latest bivalent booster. This as of the December 30th update from the CDC on the matter. Now, as mentioned earlier, the CDC did say that the data and additional analysis will be discussed at the upcoming January 26th meeting of the FDA's Vaccines and Related Biological Products Advisory Committee. But until then, it seems that the CDC will not be making any recommended changes to its existing vaccination recommendations at this time. This despite the fact that mounting data reveals that the most recent bivalent booster shows little difference from the monovalent COVID-19 vaccine. Instead, the agency continues to take a one-size-fits-all approach, as it is not deemed pragmatic during the never-ending pandemic to take any other course of action, such as a more granular, targeted risk-based approach to vaccination. The CDC, instead, in its recent press entry, put these points out as to why everyone should continue along with the current vaccination scheme. They claimed that data has shown an updated COVID-19 vaccine reduces the risk of hospitalization from COVID-19 by nearly threefold compared to those who were previously vaccinated but have not yet received the updated vaccine. Data has shown that the updated COVID-19 vaccine also reduces the risk of death from COVID-19 by nearly 19-fold compared to those who were unvaccinated. And other preliminary data from outside the U.S. have demonstrated more than 80% protection against severe disease and death from the bivalent vaccine compared to those who have not received the bivalent vaccine. So there you have it. Now, time, of course, will tell how all of this shakes out, and of course we're going to keep you posted on this situation as it continues to develop. And that, my friends, will bring our episode to a close once more. For more content like this, be sure to check back to this channel daily, Monday through Friday, and for numerous written content daily, 7 days a week, be sure to check out our website at trialsitenews.com. And as ever, always, my friends, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.